Thank you very much for congratulating me for having been appointed as the Minister of Health and Child Care for Zimbabwe. As you can see, I have landed into cholera. So that's a very difficult start, but we shall try and make sure that we understand the problem and be able to come up, with the solutions. As far as cholera is concerned, I'm coming from an area, Chitungwiza, where cholera, was quite prevalent, and there are means and ways which we have put in place in combating cholera in Chitungwiza, in controlling cholera in Chitungwiza. So I decided to come here to familiarize with what is happening and be able to come up with a plan. The situation as it is that it is quite clear we have an epicenter, the area at which most of these cases are arising from. And this is in the Glen View, Budiro area. I was just talking with the mayor, and that is definitely the area we have to be looking at. I realize that the numbers are growing by the day, the number of cases. And to date, there are about 2,000, over 2,000 cases. 2,000 cases is quite a big number. And out of those 2,000 cases, there's been a total of 20 deaths. But that's not including what might, come out of the situation today. So 20 deaths and a total of over 2,000 cases. We are putting in plans in action, solutions to the problem. First of all, we have teams, thematic teams, which are working, which we have put up, and they'll be looking at each individual area and ensuring that their particular area is well covered, each and every one of those thematic areas. We've had assistance coming from other areas, like for instance, we've beefed up the nursing staff at the treatment centers which have been created. We have a treatment center in Budiriro, correct? In Budiriro. And here at BRIDH.
And Glen View.
In Glen View. Yes, in Glen View. And then a unit in Budiriro. Yeah. We wanted to look at the problems. Why have we ended up in a situation of this nature? And we realized that someone was probably sitting on the job and not doing their work properly. And this is one of the issues we want to address in Zimbabwe as a whole, as the Minister of Health. We want to make sure that people work and not sit on their laurels. In this particular case, the city of Harare has had a big problem. This whole problem has arisen as a result of blocked sewers, and these were reported and were never repaired for at least two months. 2 months, Mayor. You were not in there yet.
There was a commission.
2 months. The work was not done. There was no repair. Right, and now we've ended up with the whole Glen View, Budiro area being affected. So as we speak, I'm told by the mayor that they are busy repairing the blocked sewers. They are unblocking the sewers. The other issue which the other problem is that garbage hasn't been collected on a regular basis. There's water problems, no water availability, and I was just discussing with the mayor. I'll have to discuss with my counterpart in local government and the Ministry of Water to make sure that we improve the water supplies in the city. Otherwise the problem will carry on. So we are looking at that. The other major problem is that of vending. There's been a lot of vending of meat and fish in the area under concern. And we have agreed with the mayor that we are going to be policing that area very strictly. And I understand that they've started vending their meat and fish at night. We're going to request for assistance from ZRP to ensure that the policing is very, very strict and we stop the meat and fish vending, in the area. So we have a problem which has to be solved. We are looking at the situation of improving the services and being able to stop the deaths. There should never be any deaths as a result of cholera. So the medical team are busy ensuring that we have adequate antibiotics, all the medication that is required. The testing schemes are in place to be able to isolate the pathogens, the bacteria which cause the diseases. And in our particular case, we've got a very difficult one actually, because we've isolated 3 species of germs in simple terms, in layman's terms. One called Salmonella, and the other one called E. coli, and the other one which causes typhoid. And the doctors have also identified that there is some resistance to antibiotics, except for one other particular antibiotic. So the technical team is working very hard in order to make sure that we get over this problem. We've put in place and requested our partners from the United Nations to give us assistance. Because the wells are contaminated, we've had to close the wells. We are not allowing people to use wells which are contaminated. Naturally, when we close the wells, we have to have the alternative. And the alternative is bringing in water, fresh water. So we've given instruction for companies to ferry in water into the area. As we speak, arrangements are being made. Water is going to be brought into the area. People will collect clean water, and we'll also provide them with the short-term solution, medium-term solution of having water tanks being installed. So UNICEF, Delta, they've given us that assistance. They will be placing the tanks, the water tanks. We've had one major problem at the schools. At one of the schools, we've lost 2 children, and there's about 20 kids who are also sick, 20 school children who are sick. We've decided that we'll suspend the classes at those schools while we bring in the fresh water. We can't close permanently because they will be having their examinations. So what we're doing is just suspend the classes while we bring in clean water, so that we can be able to resume classes when water is available. So the suspension of the classes just to enable us to be able to make sure that we have the clean water supply being made available at the schools. Otherwise, if we don't suspend at this stage, they will carry on drinking from that same contaminated water wells. And the germs that we are talking about, the bacteria that we are talking about, they've got a very short incubation period. After 3 hours, the symptoms will start showing. So that's why we have now decided to suspend the classes at these schools. It's relevant, inconvenient but relevant to save lives. At the same time, we're also going to declare an emergency, not for the whole country at this stage, but for Harare. We are declaring an emergency for Harare. And this will enable us to be able to contain the cholera, typhoid, and whatever else is going on. We need to have that opportunity to be able to ensure that we get rid of the problem as quickly as possible. And like I said, we don't want any further deaths. And so if we don't create this disaster emergency situation, we'll carry on having so many cases. So this is done in order for us to be able to control and contain the disease within the confined areas of the Greater Harare and Glen View and Budiriro in particular. I think if you've got any questions, I'll answer more questions. 2000. According to the report we've received, Harare, Budiriro, Glen View remains the epicenter, like I said. There are people who came from outside Harare and were visiting Budiriro, Glen View area. And when they went back, they became sick. Like, for instance, there's two who went to who had come to Harare to buy furniture, and they went. They came from Murambinda, from Boera, right? And then the case in Masvingo, isn't it? Yes. And then there was one case who came from Harare to Masvingo. Unfortunately, they died when they got to Masvingo, right? So, in reality, according to what we can see, the area of concern is Harare, but particularly Glen View, Budiriro area. Yeah.